Are telemedicine and virtual healthcare the same thing? In today's world, more and more medical care has been delivered through remote means. I'm Alex, and I'm going to walk you through the differences between telemedicine versus virtual healthcare, as there is some confusion about which term to use. We will talk about what virtual care includes, and finally, how to make virtual healthcare easier for you and your patients. Let's get started. Between 2018 and early 2020, the number of healthcare providers using telemedicine nearly doubled to 41%. During the COVID-19 pandemic, that number grew exponentially. One virtual healthcare provider saw his virtual visits skyrocket from 1,600 in February to nearly 90,000 1 month later. There is an ongoing debate about what term to use when describing virtual healthcare. Some use the word telemedicine to describe using electronic methods for delivery of healthcare services. Others use virtual healthcare. The differences may be subtle, but they are there if you know where to look. So let's talk about those differences. Telemedicine refers to treating patients without actually seeing them in person. That means either over the phone, by video, or by instant message. The doctor will triage the patient and provide a diagnosis remotely. Say, for example, you call the doctor's office to discuss your worsening cold symptoms. Since you have no fever, the doctor tells you to take some cold medicine. That is an example of telemedicine. Virtual healthcare, however, is a much broader term. It covers all the ways that a healthcare provider can interact with patients remotely. So this includes things like remotely monitoring vital signs with devices or following up after an appointment, such as when a nurse calls to check on a patient after surgery. As you can see, telemedicine is essentially much more specific. If you are referring to a wider set of services that are not just simply a visit with a healthcare provider, the use of virtual care or healthcare is more accurate. So we know virtual care is broader, but what does it include? We're going to talk about three main types of virtual healthcare. One way providers and patients use virtual healthcare is through remote patient monitoring. This method includes a patient using a device that can upload readings to the doctor's electronic health record (EHR) system or other monitoring device. A good example of this would be a glucose monitor or insulin pump. Remote patient monitoring is usually for ongoing issues where the patient might not need an in-person appointment, but still needs monitoring and feedback. Another method of virtual care is asynchronous telehealth. This is when medical data like images are collected, stored, and then transmitted for the doctor to assess later. For example, a patient might send a picture of their skin condition for evaluation. Asynchronous care is often used for one-time assessments. Mobile health can also be a part of virtual healthcare. These apps are usually found on devices like tablets or smartphones. They are used more for educating the patients and less for treatment and diagnosis. For example, a physician might use a mobile health app to provide instructions of what to do after a surgery. However, when people hear about virtual care, especially in our post-COVID world, they think of virtual doctor visits. Usually, these visits are conducted using video conferencing tools that comply with HIPAA, the Health Insurance and Portability and Accountability Act. They provide for a broad way for patients to get care for non-urgent issues or to undergo triage without having to leave their home. But how do you make virtual healthcare easier for both you and the patient? One way is to use forms for data collection. Jotform offers a wide range of HIPAA-compliant form templates that you can customize to meet the needs of both your practice and your patients. In virtual healthcare, there are many forms to be filled out. For example, you might ask your diabetic patient to self-report blood sugar readings while waiting for a connected device to be approved by their insurance. In another example, a patient might send you a picture of what they think might be skin cancer for an evaluation. You can use a form to have them describe the condition. There could be checkboxes for symptoms, and the patient could attach the image. For general virtual care, you'll likely want to use a patient intake form so you can collect medical history. You will also want an informed consent form for your patient to sign as well. And whether virtual or in person, you will still need to collect payments using Jotform and a payment gateway like PayPal, Square, or Stripe. Whether you deliver services that include telemedicine or virtual healthcare, make sure you are equipped to get the information that you need from your patients. After all, it is not the terminology, but the delivery of the services that matters. Let's review. Today, we talked about the differences between telemedicine and virtual healthcare while delving a little deeper into virtual healthcare. Finally, we talked about how to make virtual healthcare easier for you and your patients. I'm Alex, and thanks for watching. For more information on the forms discussed today, check out jotform.com. See you next time.